Can H. pylori reinfect after treatment? Have you ever wondered if Helicobacter pylori can come back after treatment? The answer is yes, it can. However, the chances of reinfection are generally low and depend on various factors. Reinfection means getting a new strain of H. pylori after successfully treating the original one. On the other hand, recrudescence refers to the return of the original strain that was not completely eliminated. To understand this better, let's look at some key details. Reinfection rates are usually measured after a person has tested negative for H. pylori for a year. If symptoms return within that first year, it is more likely due to recrudescence. But if symptoms come back after a year, it is often a new infection with a different strain. In developed countries, the annual reinfection rate is quite low, typically between 1.5 to 4%. Some studies suggest rates around 1.5% per person per year or 2.66% annually. However, in developing countries or places with poor sanitation, the rates can be higher due to easier transmission of H. pylori. So, how does H. pylori spread? The bacteria are mainly transmitted through oral or fecal-oral routes. This often happens in households or among close contacts. Factors that can increase the risk of reinfection include living in crowded conditions, having poor hygiene, and being around infected family members. To prevent reinfection, it is crucial to not only have effective antibiotic treatment but also to adopt better hygiene practices. This includes washing hands frequently, avoiding sharing utensils, and keeping a safe distance from infected individuals. Long-term studies show that, after the first year following successful treatment, the rate of reinfection decreases and approaches the natural rate of new H. pylori acquisition in adults. In the context of ulcers and peptic ulcer disease, preventing H. pylori reinfection is vital. Persistent infection is a leading cause of peptic ulcers and can lead to serious complications like bleeding or even gastric cancer. Therefore, anyone treated for H. pylori should be informed about hygiene and lifestyle measures to minimize the risk of coming into contact with the bacteria again. If symptoms return after treatment, it is important to consult a healthcare professional for follow-up testing. While reinfection is possible, it is relatively uncommon in many settings. Understanding the difference between reinfection and recrudescence is essential for effective clinical management.